marijuana does not repair, solve, or cure cancer, nor it delays the progress of cancer. I mean, to this day, we have no evidence to suggest for or against it, but it really doesn't add up from what we know physiologically of, the endocannabinoid system and actually what marijuana does. My name is Cristian Zanartu is my actually Spanish sounding name. They call me Dr. Z here at the clinic. I am, what it is that I do is I'm a palliative care doctor. What palliative care means is that I take away the suffering of advanced and chronic conditions. A retired nurse came to see me about two years ago. He was in his 70s and he had survived multiple myeloma, which is a cancer of the bone marrow. He had been doing great, but during the course of his treatment, like oftentimes patients with multiple myeloma do, he had fractured one of his vertebral bones. And that fracture had caused him a lot of pain, so he had been prescribed oxycodone. 2 years afterwards, cancer was long gone. Whatever had happened in his bone was now just a scar. Like a lot of people live with fractured vertebral bones. We're the only species that wanted to walk on 2 feet, so our vertebrae suffer and they fracture. Most people don't feel them, But this man had continued to have chronic pain. And that's where the question becomes, is oxycodone remedying this, or is oxycodone actually the reason why your pain has become chronic? If you're giving the brain a positive reinforcement for every time it senses pain, are you chronifying the pain experience itself by just giving the substance? So at this point, he was not only still in pain, but also dependent on oxycodone. And because he was a very mindful, retired, educated person, he said, I don't want to live like this. I don't want to chase a doctor every month to get my fill. I don't want to take a tablet every 6 hours. I don't want to be in so much pain. And among other things, I suggested medical marijuana. The regimen I suggested for him was a high-dose CBD, high-dose THC on a 1-to-1 formulation that he would take as an oral twice a day to give him a level, and that he could rescue with a vape of high THC formulation. He had some experience with marijuana before, but he wasn't a chronic user, by all means. We also added other medications for chronic pain that he wasn't using, like Lyrica, compounded creams. There are a lot of other resources that are not opioids. And we started a gentle down taper from the opioids simultaneously. It's been 2 years. He's a happy man on medical marijuana, which he takes every day less, opposed to what he was going through with oxycodone, which was the need for every day more. He has gained weight, which has been a downside of the solution because marijuana has made him very hungry. But despite that, he's tremendously satisfied. He's freed himself from oxycodone, which, if you think about it, not only from a practical standpoint, but from asserting your own dignity standpoint, the fact that you're free from a substance means the world to him, And there he is, doing water aerobics with medical marijuana, Lyrica, and a topical cream off of an opioid. So I have a few of them, patients with chronic pain who were committed and motivated to get down tapered and discontinued from their chronic opioid therapy, which they felt was taking more away from them than giving them. And they have used marijuana as one of the elements, usually rehabilitation being a huge one there, of their recovery. In cases that have been more disappointing, I think I've seen a lot of people who, through internet exploring of themselves, they have found that, articles where it says that marijuana cures cancer, So I have had a lot of patients who, with, cancer of poor prognosis, meaning people who are likely going to be dead in 6 months, they start to use high-dose marijuana. They ask me to be enrolled into the program with that expectancy, with that expectation. And of course, it's been disappointing for them because marijuana does not repair, solve, or cure cancer, nor it delays the progress of cancer. I mean, to this day, we have no evidence to suggest for or against it, but it really doesn't add up from what we know physiologically of the endocannabinoid system and actually what marijuana does, right? We're thinking about where the receptors of the endocannabinoids are located in our bodies, how tissue from where cancer comes out, like digestive tissue, lung tissue, are not particularly highly expressing of marijuana receptors. And there's pretty much no clinical evidence to point in any way that marijuana will play an anti-cancer role. And I believe that there's been a little bit of misinformation there. So that's been, I think, a lot of the disappointment.